Hello, my name is Dr. Carlo Carandang, and I'm a psychiatrist. Today, I will talk about the negative cycle of performance anxiety, also known as stage fright. Stage fright is the fear of performing in front of an audience as you are fearful that you will embarrass yourself, or you may be fearful that they may not like you, or you might be fearful that people will make fun of you because of your horrible performance. So stage fright can affect people such as musicians, singers, or people giving a presentation to an audience. So let's look at how performance anxiety evolves. Here is an example of the negative cycle of performance anxiety. So let's say your trigger is singing in front of an audience. This situation then induces thoughts about the event. So you may think, quote, everyone will make fun of me, or quote, they will think I'm stupid, or quote, I will embarrass myself, or quote, they will not like me. These thoughts then induce anxiety, and you may feel nervous, fearful, self-conscious, and you may also get the physical sensations of anxiety, which is caused by the release of adrenaline into your bloodstream in reaction to the anxiety. So these physical sensations of anxiety induced by the adrenaline include things such as racing heartbeat, pounding chest, lump in the throat, butterflies in the stomach, sweaty palms, shaking knees, trembling knees. So these are all examples of the physical manifestations of anxiety you can get from anxiety due to adrenaline coursing through your bloodstream. So the anxiety then is very uncomfortable and it makes you want to avoid. So you then try to avoid these singing gigs as much as possible. However, if you do end up going to your singing gig, then you will avoid eye contact. Maybe you will not sing. Also, you may not be able to sing because you got a lump in your throat, but you also may consciously choose not to sing when you get up in front of people. You may also hide. You might drink more or smoke more to help calm your nerves, or you might just plan your escape altogether. So these are examples of safety behaviors that you might engage in if you choose to attend your singing gig. So safety behaviors and avoidant behaviors, these maintain the belief that people are making fun of you. And it also continues with your self-focus, and this in turn just maintains the negative cycle of performance anxiety or stage fright. So, although the avoidant behaviors decrease your anxiety over the short term, the behaviors actually maintain your overall anxiety from the feared stimulus over the long term. So the avoidance maintains the belief that people are making fun of you. And it also maintains your self-focus, which continues with this vicious negative cycle. So the feared stimulus induces thoughts, which then induces anxiety, which then compels you to avoid. So instead of just exposing yourself to the trigger and finding out nothing bad will occur, you avoid the trigger, and this maintains your belief that people are making fun of you. And then you also maintain your self-focus. So with the avoidance, you never get to find out that the anxiety will go away naturally if you just stay with your trigger. So if you just stay on stage and you continue singing, you will find out that after a few minutes, your anxiety will go away naturally. And what a lot of people don't know is that you need a little bit of anxiety to actually have optimal performance. So say if you had no anxiety, then you might not perform well at all. You need a moderate level of anxiety or arousal to actually have optimal singing performance. So you need some anxiety to actually help you. You can't just get rid of all of it. You need some of it to actually perform well. But you can't have too much of it, and that also makes you not perform well. So what I'm trying to get at is that you have to stay with you have to be exposed to your anxiety. And after a few minutes, the anxiety will go away. But you need a little bit of it to have an optimal performance. So what's the solution? Well, the solution is cognitive behavioral therapy, otherwise known as CBT. CBT helps to break the negative cycle of performance anxiety by changing how you think and what you do. It is difficult to change the way you feel, so the focus is on changing the way you think and the way you do things. For more information and help on performance anxiety, otherwise known as stage fright, and other anxiety problems, please visit anxietyboss.com. I'm Dr. Carlo Carandang. Thank you for listening.